This segment is brought to you by healthcareforyou.com, part of the Job Creators Network. And joining us now, we love to get doctors on to figure out what is going on here. We have Dr. Caterina Lindley, and she's from Yugoslavia. Now, her mom died because of socialism, she says, and she is joining us now. Dr. Cat Lindley, great to have you with us, and thanks for being up so early for us today.
Thank you for having me.
Dr. Cat, tell me your story. Tell me about your mom and socialism, and how did you get to the United States?
So I was 18 and I actually left Croatia one day before the war started. I went to live in Italy and work as a nanny. And the hard part about that time was probably for about 9 months I couldn't hear from my family because of the war. And it was, very difficult time for someone my age to have to deal with that. Mm-hmm. So I was in Italy for a while, saved enough money, came to the States, went to college here and all that. And when I was probably about 10 years ago, I was pregnant with my fourth child. I have 5 children. Mm-hmm. I was pregnant with Jack, and I was 6 months pregnant, and my brother and my sisters are a little bit older, so they tend to kind of cuddle me and want to protect me. So they didn't tell me my mom was dead sick, but I found out that she was actually dying from tuberculosis. Mm-hmm. And I was not allowed to fly because I was pregnant, mm-hmm. and they didn't want me to be close to her because of the disease she had. Mm-hmm. So I had to say goodbye to her over the phone, and it was, as you can imagine, very hard. Mm-hmm. But one of the reasons that she, had to deal with tuberculosis was the fact that there was delay in diagnosis. She had the same symptoms for probably 5 or 6 years, and it would happen about the same time of year, and it was treated as flu or pneumonia, and it took them a long time to diagnose her and be able to treat her for what she had. And I actually just spoke with a friend of mine from Romania, and this is even harder, I think, maybe because I had time to process my own. But her dad was diagnosed, he had chest pain and being diagnosed with cardiac disease. Took them 2 months to diagnose him, scheduled him 4 months later for surgery, so that's about 6 months. And he died one day before the surgery. So, things like that happen just because when you have one payer system, and when you have a lot of people, there's going to be rationing, wait lists. At some point, even people who are going to decide whose life is more important, 86-year-old person who needs hip surgery or a 65-year-old that needs knee replacement. It just kind of becomes one of those things where no one has control other than bureaucrats. And in my opinion, having lived through that, I don't think it's a good idea.
So in both Romania, obviously, and Croatia,
mm-hmm.
your family and your mom, and then your friend's father, they were getting care under a government-run socialized medicine system, right?
Yes, and actually, my mom was diagnosed with ovarian cancer probably about 3 or 4 years before this happened. Mm-hmm. And at that time, we decided as a family that we will go the private route. And we paid for her care privately, and she was able to get surgery and everything done in time. So in my opinion, again, this is just my opinion, as I'm probably wrong for all it is. But if we do go the single-payer system, what's going to have to happen is we don't have enough physicians, we don't have enough PAs and nurse practitioners. What's going to have to happen is going to be almost like a mandatory call-in of all physicians and health workers to be part of this, right? Which means that we're going to all be eased up into this system, whether you want it or not. And initially, I believe there won't be any free market because there can't. There's just not enough healthcare workers. They're going to have to do something to cover everyone. And then eventually, a system fails, which it will because it has failed everywhere. There's going to be that other arm of the free market, like they have it in Britain and things like that.
You're on the John Fredericks Radio Network. We are with Dr. Cat Lindley. She is from Croatia. So you left Croatia, that was during the Serbian War. right? You went to Italy, and then you came to the United States. How old were you, Dr. Cat, when you got to the U.S.?
The first time I visited, I was 21.
Mm-hmm.
And then I think I stayed back when I was 22. So I lived in Italy as a nanny for a family, and they had a house in Florida, so we came that route. And I was able to switch my visa from visitor to student, and saved enough money to go to college in Florida Atlantic University.
Yes.
Eventually got married. Now still married with 5 children. Went to medical school in Florida, and here I am.
All right. So now, so you got married. You got married, I assume, to a U.S. citizen here, doctor?
Yes, sir.
And then you graduated. You went to Florida Atlantic, graduated there, and you're a DPC doctor, I understand, right?
Yeah. Yes, I do direct. I'm a family physician, board certified in family medicine, but I kind of got disillusioned by the system. As we started having more and more regulations by government, we started spending more and more time with our computer. And for someone like me who is not I'm not great at my computer. Obviously, I do fine, but I would spend half of my time with my back to the patient, trying to write down what they're telling me, and then clicking the boxes that didn't make any sense. Mm-hmm. So I would come home disillusioned, hated what I was doing. And a friend of mine just said to me, why don't you do direct primary care? And the only reason I never wanted to go that route is because I hate the idea of being my own boss. I was, right. Having children, it was kind of nice to do your job and go home.
Right.
But things happened, and I decided to go that route, and now it's the best thing I've ever done. It's you have no idea how much I love medicine right now, and I'm in a small town in Texas, kind of on the outside of Fort Worth. And there are times when I work until 11 o'clock at night, but it's the best thing I've ever done. I do home visits. I meet patients whenever they need to be met, and it's just wonderful to be able to have this relationship where patient is participating in their care. They like what I'm doing, and it's changed my life.
So Dr. Cat Lindley, we're with Dr. Cat Lindley. She's a direct primary care physician, came from Croatia, and put herself through school, got married, has 5 children. When you say that going to direct primary care changed your life, changed your attitude, you can spend more time with your patients, tell me about income-wise. I mean, were you able to make, you have a family, you're a doctor. Mm-hmm. I mean, we're all, we all have to get paid. We all want to make enough money to be comfortable and support our family. So income-wise, when you stopped taking insurance and went to a direct primary care environment, how did that affect your income?
Mm-hmm. So I'm not sure if you know exactly how it works, but direct primary care is we don't, like you said, we don't take insurance. Right. And we do monthly membership kind of based on age. Mm-hmm. And it's very affordable. My membership is, my highest membership is $75 a month. Mm-hmm. And patient has unlimited, they can be seen as many times as they need. Usually it's the same day appointments, as long as I can accommodate. And it's nice. Patients really don't abuse it. They don't call you in the middle of the night or anything like that. But as far as the income is concerned, usually physicians who have panels of about 600 patients make pretty close to what they made in the insurance environment. For myself, my panel is closer to probably about 300 or so. I'm comfortable where I'm at. Would I add more? Probably if I wanted to, but I also do occasionally urgent care. Mm-hmm. And so I feel like I can supplement my income if I want to. And I think at some point in your life, you reach, you reach a point where money is really not everything, and as long as my family and I are comfortable, I'm fine. And I would rather make a little bit less but be happier in what I'm doing.
I tell you what, that is a fantastic story, and you certainly prioritized Dr. Cat Lindley, the relationship with your patients, the one-on-one relationship with your patients, as opposed to other priorities. The story of you're sitting with your back to the patient on the computer, I mean, my doctor does that now. Bless his heart, is not his fault. I mean, but he's got to input all that stuff. And when you say check all those boxes, you spend half the time doing that. So I certainly understand it. Let's get to the plan, healthcareforyou.com. I know you've seen the plans in detail. Obviously, you've had loved ones that have lost their lives because of socialized medicine and bureaucrats making decisions rather than their primary care doctor, which they have to go through the governmental system. What is it that makes you such a supporter of that particular platform?
So, as you know from my story, I'm a legal immigrant, and most legal immigrants believe in a right of choice, because the reason we came from different countries and things like that is because usually people choose for us, right? So one of the reasons I feel that this, plan like this or different plans that are similar to this are important is because it gives you choice. First of all, it emphasizes that relationship between physician and patient is the most important. If you and I decide that you need one type of medication or you need MRI, just to give you an example, CMS recently came with this thing saying, it's the best thing ever. To get an MRI for Medicare patients, you're just going to have to go on the website, click these boxes, put the right diagnosis, and if everything's correct, we'll approve it. But why? Why, if my patient needs an MRI, I'm not an idiot. I'm not going to order it just because I want an MRI. I'm going to order it because patient needs it. So this type of plan, Healthcare for You, emphasizes that it's a decision between me and patient what the treatment will be and what our health journey is going to be. And the other thing is you're going to choose what's best for you and your family. If you like MedShare plans, you're going to go with MedShares. If you like high deductible plan and you want to pair it up with direct primary care physician, you'll go with that. One of the things I realized when I started my direct primary care practice it's going to be 2 years, December 13, so it's coming up. Healthcare is cheap, but what's not cheap are the bureaucrats that are hiding behind the healthcare. So to give you an example, I have insurance, and my son, he's 15 years old, playing football, needed, fell down, got injured, needed MRI of his knee. I could have gone the insurance round and paid $2,500 for that MRI, or I paid cash myself because I knew what the cash price is, and I paid $400 for that MRI. There are places in U.S. where you're going to pay $250 for MRI. So healthcare by itself, the physician, even the labs, I can get blood work for the whole physical for the whole year for less than $20. But if you go to insurance, sometimes it's $500 because they negotiate the rates, you have deductibles and things like that. Healthcare is not expensive. It's the bureaucrats behind it that are expensive, and that's why it's inflated. So plans like this emphasize that you can do direct care, you can do direct specialists, direct primary care, and if you couple that with different plans that are good for you, that's how you do it. And another important thing of this plan is transparency in drug pricing. Drugs are so cheap. I had a patient that needed Zoloft, which is an antidepressant medication. Insurance wanted me to do prior authorization for medication that costs for 90 days, cost $8 at Walmart. I told patient, here is $10. I have no time to do this. Because for me to do prior auth, it can take me anywhere from 30 minutes to 2 hours. I just don't have time for that. Plus, I have no patience for it.
So you just gave her the $10?
I gave her $10. I don't want to do this.
This is, I don't know how we get this story out nationally. People don't even understand this. So let me get this straight. Let me get this straight, Dr. Cat. We're with Dr. Cat Lindley. She's a direct primary care physician in Texas. She has her own practice. She's been through the insurance ringer. She's from Croatia. Saw one of her good friend's dad and her mom both pass away because they couldn't get the proper care under the socialized medicine system in both Croatia for her mom and Romania for her friend's dad. So let me just get this straight. Your son plays football. He has an injury. You have to get an MRI, right? Common thing. My son plays baseball. He hurt his back in the fall. Common thing, right? Got to get an MRI. So you simply, as a doctor, you shopped it, cash price. You went to one of the places that does legitimate MRIs. You have all the same equipment, same doctors. Everything is the same. You paid cash. It's $400. You go through insurance. It's $2,500. And what you're saying, it's same procedure, same doctors. Everything is the same. Same equipment.
Same place.
Same place.
If I went through insurance, it would have been $2,500. Same place, everything exactly the same. Or I could. What I did, I said I'll just pay cash for this, and it was $400.
I mean,
not the place that costs.
This has got to be the untold. This has got to be the untold story for healthcare in America. I mean, right here, what you're saying, and we've had a couple other doctors on saying the same thing. Everybody we get on is saying the same thing, and the fact that even for the drugs now, we had one doctor on last week that I guess got a pharmacy license or whatever she had to get in order to dispense prescriptions right out of her office. And, she was getting the generic prescriptions. And she was saying that it was like, they go to Walgreens, it's like, hundreds of dollars. They go to her, it's $12.
Oh, I have a better story than that. So I'm in Texas. We're not allowed to dispense medications. One of my good friends actually sued the state of Texas because we've been trying to pass the bill. I do a lot of legislative things, so we've been trying to pass this bill forever. So we're not allowed to dispense. But I have a friend in Kansas. His patient needed breast cancer medication, and oncologist told him what medication. Patient went to CVS and Walgreens with her Blue Cross Blue Shield. It will cost $1,900 or $2,200 a month. He got a medication for $6.86 or 96 cents. I forget. I was messed up, but less than $7 a month. So the whole drug pricing is travesty.
Well, it's all the insurance, the bureaucrats, the system that we've created. And now what the Democrats want to do is take that failed system, the $2,500 MRI system, take your story of your mom and your friend's dad, bless their hearts, and like double down on it. I mean, it's an insane way to go forward based on the knowledge that we have. Dr. Kat Lindley, we're out of time. I've got to have you back. In fact, I got to have a roundtable with several doctors at the same time. I'm going to ask our people to set that up. But thank you for getting up early. It's an unbelievable story. Thank you so much.
Thank you for having me.
All right, Dr. Kat Lindley.